start collecting your Social Security benefits at a reduced rate for retirement or survivor benefits or spouse benefits or divorce spouse benefits, they're always reduced. You hear that all the time. Is that true? Well, yes and no. As anything with Social Security, there are exceptions, and different programs. So I'm going to talk about some of those today. Who am I? My name is Ed Weir. I'm a former manager of the Social Security Administration. I've taken hundreds of thousands of Social Security claims throughout my life. I've helped millions of people get everything they're entitled to. In my semi-retirement, I'm doing all these videos here and trying to make sure everybody's getting what they need. A lot of people are hurting out there. They need extra money. So that's my new mission in life. And this is also a live Q&A. If you're watching this live and you've got questions, make sure you type them down in the chat. If you're watching them on a recording later, make sure you subscribe. And that way, if you do have questions, you can find us again in the future. I'm going to be doing updates once the new COLA and the new annual earnings limit and everything like that comes out for 2025, and give you all the details on how to make sure you're taking full advantage of all of those new numbers. All right, so let's go ahead and get started here. Again, type your questions. I already see a bunch of questions in the chat down there, but we'll talk about them after I finish how to unreduce your reduced benefits. Well, one way to unreduce your reduced benefits, I'm going to talk about 5 or 6 or 7 of these. A couple of easy ones are obviously the COLA. You get the cost of living allowance every year. And, this year was 3.2%. I had done several videos that it should be about 2% more over the last 20 years, but the way they calculate it, I think, is completely incorrect. But we need to work on that. Another way you can unreduce your reduced benefits is working. If you work and pay into FICA, which you will pay into FICA, even if you're receiving a Social Security check, or even if you're receiving Social Security benefits, you will pay FICA forever until you're 80, 90, 100, until you shuffle off your immortal coil. But Social Security calculates your benefits by the high 35 years of earnings. So the high 35 years of earnings, if you're 80 years old and you work and you pay into FICA, whether it's wages or net income from a business or something, and that's one of your high 35 years, then Social Security automatically goes in there and recalculates your benefits. That's 100% automatic. It takes a little bit of time. You get your COLA increase, immediately in January. But the high 35 recalculation, that doesn't happen until a few months later, because you have to do your taxes and notify the IRS, and the IRS notifies Social Security, but they give you the retro. So if it increased your benefit by $10, $15, $20 a month, they'll give you that going back into January. So that's one way you can increase your Social Security check. Another is withdrawal. If you take your retirement benefits early at 62, 63, 64, whatever the case may be, and then decide, oh, I shouldn't have done that, you can actually completely negate that. You can withdraw your application completely within the first 12 months. And because you're withdrawing your application, it's like it never happened. And therefore, that money they gave you for the previous 12 months never happened. So that means you have to pay that money back. So if you're reduced and you're like, oh, no, I shouldn't have done that, or, I found a new job, I'm going to be way over the annual earnings limit, so I should have never taken that because I want this job and now I'm limited and yada, yada, yada. You can just go ahead and call the Social Security and say, yeah, no, never mind. And they'll get you set up. Again, that has to be within 12 months and you have to pay that money back. If you get a job and it's not within 12 months and you don't want to withdraw, and you're making over the annual earnings limit, and Social Security holds back $1 for every $2 you go over, then what you can do is just go ahead and work. And every month Social Security doesn't pay you, they will readjust that in the future. It's called ARF, the Adjustment of Reduction Factor. So a lot of people don't know about this. So let's say you take your Social Security benefits 30 months early. Okay, so you're reduced by 30 months. You've got a 30-month reduction of your Social Security check. But then, let's say after 10 months, you go back to work and you work and don't get a check because you made over the annual earnings limit, and Social Security withheld 20 months of checks. So technically, you only got 10 months. So once you hit your full retirement age, the computer system goes back in there and says, hey, this person and their benefit amount is reduced by 30 months, but they only got 10 months worth of checks. they will adjust that reduction factor automatically. That's at your full retirement age. That's completely automatic. The system goes in there. And so you're basically, for the rest of your life, your benefit is not at a 30-month reduction. It is at a 10-month reduction for the rest of your life. So that's another way your benefits will increase. All right. And let's see another one here. Not many people use this one. Not many people know about it. I think that's probably one of the biggest reasons. Even Social Security employees don't know about it. Every time I tell people about this and they go in there and they do it, the local Social Security office, you know, looks at them like they're alien. They don't know what they're talking about. And it's like, what, yeah, there's no, but I always have to provide the reference on this one. So if you want, I can provide the reference. The policy, Social Security has 20,000 pages of policy. And this one is not used very often, but I'm sure there's someone out there. People use this all the time. It's called voluntary delayed retirement credits. Okay. So basically, if you're receiving early retirement and you hit your full retirement age, you can actually stop your benefits at your full retirement age and get those delayed retirement credits. So you're voluntarily stopping your benefits to get those delayed retirement credits. And what's delayed retirement credits? That's 8% every year you wait after your full retirement age up to the age of 70. So that's 24%. So you can increase your Social Security check by 24% by stopping your benefits at your full retirement age and then starting a year later, 2 years later, 3 years later, and get up to 24% extra. A lot of people say, well, I can't do that because I need my, then that strategy is not for you. This video goes out to, a lot of different people. So again, how do you do that? You contact the Social Security Administration and you tell them, hey, I'm going to be my full retirement age next month, 2 months, 3 months down the line. I want to go ahead and stop my benefits, get that 8%. So, and one of the biggest ways to increase your Social Security check is with the way I've done over 700 videos. It's all of the different programs people don't know about. The second check that people are missing in terms of you're getting disability, you can get survivor benefits. You're getting disability on your own record. You can get survivor benefits on the deceased spouse benefits. You can get spouse benefits on a current spouse or a divorced spouse or an independently entitled divorced spouse. If you're receiving retirement on your own, then you can get switch it to survivor benefits. If you're receiving survivor benefits, you can switch on to your own when it reaches the full retirement age or get the delayed retirement credits. That's the one that people every single day through this live Q&A, if you watch the live Q&A, you see people come in every day and say, hey, I took your advice. I went down to Social Security and now I'm getting a whole bunch more money and stuff. So people find more money all the time because there are other programs. If you're, for instance, let's see, if you're receiving your retirement benefits and you're receiving divorced spouse benefits from someone you were married to for 10 years, and then someone else you were married to for 10 years passes away, survivor benefits is more. So if you're getting benefits as a spouse on someone's record, you get up to 50% of that person's full benefit amount. Surviving spouse benefits, widow, widower, same thing. You get up to 100%. So you're like, okay, yeah, I know this second spouse, ex-spouse of mine made a lot more money, so I'm going to stay on that person's. But yeah, the first spouse might not have made a lot of money, but that person's deceased and you get a lot higher percentage. So there's a lot of people out there missing that money. And that's why I do these live Q&As and hundreds of videos to help you get everything you're entitled to. Another thing on Medicare, how to increase your benefit is, decrease that $174.70 you're paying for Medicare. If you or someone is struggling, having to pay that, Part B premium, they can apply for Medicaid through Department of Social Services. And if they're approved, Medicaid, the state Medicaid office will pay for their Medicare Part B premium. So you can have Medicare and Medicaid. A lot of people don't realize that. Medicare and Medicaid, just as like you can have Social Security disability insurance and SSI, which is a welfare-based program. You can have SSI and retirement on your own benefits and Medicare and SSI and the Part D prescription drug assistance and Medicare savings program paying for your Part B. And if you have Medicare and Medicaid, you're dual eligible and you can get one of those Medicare Advantage plans. Usually I don't recommend Medicare Advantage plans. I talked about this yesterday. A lot of people get it because they, can't afford a Medicare supplement plan, which I understand. But if you have Medicare and Medicaid, yeah, 100% Medicare Advantage plan, a dual eligible plan, they cover so much more, a lot of different benefits. Another way you can save money to increase your check is Medicare Advantage Pro plans are allowed to do this, what's called a Part B give back. And a Part B give back is you sign up for this Medicare Advantage plan if there's one available in your area, and they pay for part of your Part B. Um, I always say be kind of careful on that if you're kind of you're not healthy, because these health insurance companies, they don't get to be billion-dollar health insurance companies, for nothing. If they're going to give you money essentially for free after, well, it is your money. If they're going to give you your money back for free that they're having, because that money comes from all those decades you paid in a FICA. But anyway, if they're giving you that money for free, essentially, to pay for your Part B premium, they're going to take it out of other places. So in terms of, you're going to be charged more if you go to the hospital, they get charged more if you have an MRI and all kinds of different things. So, but if you're healthy, Part B, give back, use that for a year, get back, $50, $174, all of it, $100, and, get some extra money there. And then the following year, because Medicare Advantage plans are only good for 1 year. They all expired December 31st and new ones take effect. This month is the month you're getting what's called the ANOC, the Annual Notice of Change. So you've gotten all of that. And if you need help, I've put together a Medicare team that can help you out. I was tired of people, all the let me say it diplomatically, without my Marine Corps sergeant coming back in there, but all of the less than outstanding Medicare people out there that, yeah, they're kind of not doing their job. So I had said, forget it. I'll just, put together a team that I know and trust. So if you need help with Medicare, just click that button. And if you want us to, we can actually review your plan for 2025. So you click that little button there, the QR, do the little QR code, or call. Let's transition to our live Q&A here, or you can call that number or email me and say, hey, Ed, put me on your list for October. And when October comes around, we'll have somebody give you a call that's licensed and contracted with several different carriers in your state and give you all your options. And if you're in the best plan for 2025, your current plan is still the best one for 2025. You don't have to do anything. We'll talk to you next year, except for share this information and make sure all your friends and family are getting all the benefits they're entitled to, obviously. But if they find something better, they'll give you options and you say, oh, okay, that sounds like a better plan than I got now. Saves a lot of money. And so they'll get you all set up. All right, let's get into the questions. So if you don't have any questions, see ya, take care. But make sure you subscribe, and that way you can find us again when you do have questions. All right, Lori asks, I'm 64 and want to apply for my uncomplicated retirement benefits and work part-time within the earnings limit. What's the best way getting processed in the shortest period of time? In terms of retirement benefits, online applications, they're making that easier and easier and easier all the time. So you can apply, up to 3 months before, or you can, if you actually want to talk to a human being, it'll take a while, but you can call the 800 number, 800-772-1213, and schedule a phone appointment or an in-office appointment if you're feeling really adventurous. But you can do a phone appointment. And nowadays, they changed it a few years ago where you don't even need a birth certificate. If you were born in the United States and everything is correct in terms of your date of birth on your Social Security card. I know your Social Security card doesn't have a big date of birth, but it does internally. And your name and everything is correct, and you don't even need a birth certificate. So, and if you're working part-time, as long as you're under the annual earnings limit, that $22,320, you're good. If you're over it for this year, but you're going to start benefits next month, for the first year, they can use what's called a monthly earnings limit. So the first month you go under $1,860 and you stay under that amount, then you're good. You can continue to receive your benefits. So that's probably the easiest way to do it. All right, let's see here. I was laid off in February and started Part B and Plan C. Plan C is what they call Medicare Advantage. I wish they wouldn't call that because it makes it sound like it's an official part of Medicare, but these are private companies. But anyway, In March. I am my full retirement age, April of 2024. If I return to work full time, can I sign up for employer credible insurance? What happens to Plan B and Plan C? Yeah, if you go back to work and have credible coverage, that is, insurance through current work, and you're happy with it, and your employer has 20 or more employees, then you can go ahead and suspend Part B, get off that Medicare Advantage, and work, years and years and years, and just have that employer health plan. That's one of the other ways people waste a lot of money is they sign up for Part B because they hear it's mandatory. But, nothing in life is mandatory, but as the old Marine Corps sergeant says. But if you don't, there are repercussions. So yes, you do have to sign up for Part B unless you have health insurance from work, your current work, not retirement plan, but it has to be current work, yours or your spouse's. And that employer plan has to have 20 or more employees. If you're good with that, if current work, 20 or more employees, and you're happy with it, then you don't have to sign up for Part B. You can wait. A lot of people sign up for Part B and pay out that $174.70, and just that's a complete waste of money if you've already have other health insurance. A lot of people do sign up for the Part A alone because you can restrict your application. Say, I just want to sign up for Part A. Okay, fine. I just want to sign up for Part A and Part B and not start my Social Security benefits. Fine. I just want to sign up for Part A and not start my Social Security benefits. Fine. Then either of those, you can restrict your applications with no problem whatsoever. Let's see. All right. Take and Took is always looking out there for the community there, giving us suggestions. Good, good, good. Let's see. Sherman. Wife was told a few years ago she could not get her Social Security because I made too much. Is this correct? So wife was told a few years ago she would not get it. This is your wife, I assume. And no, that is not correct. Because if she files for benefits on her Social Security record, only her work counts in terms of the annual earnings limit. So whatever you make, unless you're self-employed type, you've got your own, you both have a business, but that's probably put under one Social Security number unless you break it out into two different ones. But it's based on her work regardless. So that doesn't sound correct at all, unless we're talking about SSI, which is Supplemental Security Income, which is the welfare-based program. And yes, then possibly yes, because SSI being a welfare-based program, if you're apply for SSI and say, hey, I really need this welfare-based benefit, and you're married to someone that makes $1 million, then yeah, that your income will definitely be held against her. Megan, my neighbor is 68 here. I always like to hear these. I love these. My neighbor, my friend, the little old lady down the street. I love y'all looking out for each other. Perfect. My neighbor is 68 and is over 67 and has been on disability for 20 years. Can she get a part-time job? And if she does, will it affect her Social Security? Yeah, no, she is no longer on disability. Once you hit your full retirement age, your disability stops and you're switched to regular retirement benefits. Most people don't even recognize they've been switched because the check stays the same, direct deposit stays the same. But yeah, once you're hit your full retirement age, nobody in the country is receiving disability after their full retirement age. They've all been switched to retirement benefits. And because they're receiving retirement benefits, then there's no, after your full retirement age, there is no limits to how much you can make. So she can go out there and make $1 billion a month and it won't affect her Social Security check at all. Well, it'll increase her Social Security check probably. But yeah, there is no disability. There is no CDRs anymore, the continuing disability reviews. There's no limitations on work or anything like that. So for people on disability, I always recommend, if you're receiving disability, here's some times in your life that you really need to check. I've done a video on this. But basically, if you're on disability and you hit 60 years old, then you need to see if you're entitled to any survivor benefits. So if you were ever married to anybody that passed, you can start getting survivor benefits at 60 years old if those benefits are higher than your current disability amount. So yes, you can get disability and Medicare and survivor benefits starting 60. If you're 60, when you turn 62, you should see if you're entitled to any spouse benefits from your current spouse or a divorced spouse that hasn't filed for benefits yet. As long as they're 62 and you've been divorced for 2 years, at least 2 years, then you can get benefits from those records added on top of your disability benefits. You'll get 50% of that minus your own, obviously, but you can get both of those. The next time in your life on disability is 65. In most states, when you get disability, you get Medicare after 24 years, where everybody gets Medicare after 24 months. But in most states, the plan to wrap around that or to cover the gaps of original Medicare, there are Medicare Advantage and Medicare Supplement plans. In most states, you can't get a Medicare supplement plan. And if you can, it's like 2 or 3 or 4 times expensive than anybody else. But once you hit 65, you're in that golden opportunity where they cannot deny you or charge you anymore. So if you've had a Medicare Advantage for years on disability and you want a plan that doesn't have any networks or prior authorizations and you can afford the monthly premium, then check and see if if you want to switch to a Medicare supplement plan. Again, my team can help you out with that. And then once you hit your full retirement age, 66 and 8 months or 67 or what, you're no longer receiving disability. Don't sweat CDRs, don't sweat work. You can, if you're able to work, go for it. More power to you. So those, if you're on disability, 60, 62, 65, and your full retirement age, those are the years you need to kind of do something and see if there's any more money. And when you come to those years, you come back here and say, "Hey, Ed, what did I have to do at 62 again?" And we'll walk you through the entire process. Hopefully, I'm still here in 2 years or 4 years or 5 years. I'll try my best, but life is what happens while you're making other plans, right? If you make too much and owe money back, do they withhold your monthly check the following year, or do you pay it back on your tax forms? Yeah, not on your tax forms. That's separate, the IRS. So you're talking about the annual earnings limit. So if you make too much, um, both basically, so let's say you make $10,000 over this year, over the annual earnings limit. So if you're in the one, they hold back $1 for every $2 you go over. If you're $10,000 over, then you owe $5,000. So they will send you a nasty gram the following year once you do your taxes and you notify Social Security how much you made, and they say, "Hey, you made $10,000 over. You owe $5,000." So they'll send you that nasty gram and say, "Pay us that $5,000." But then they will also use your work for the previous year going forward. So they'll say, "Hey, this person, $5,000 over." So what they normally do is withhold the first checks. So if you're receiving $2,000 a month and you're going to be $5,000 over, then they'll withhold 3 checks, 2,000, 2,000, and 2,000. They don't hold back partial. They don't, hold back 1,000 and then send you the other 1,000. No, they can't do the partial months like that. But again, remember at the end, they'll readjust that according to the adjustment of the reduction factor. But if you worked over this year and then stopped and you're not going to go over next year and you don't want those months held back, you just call Social Security and you do what's called a work report. And you say, yeah, I went over $10,000 last year, but I've now stopped or I reduced my earnings. So don't withhold my first 3 checks. So, and then in terms of the overpayment, I've done tons of videos on overpayments. Anderson Cooper did a phenomenal expose on overpayments and Social Security, which changed the laws or the regulations on overpayments. So watch those videos. Yeah, it's a lot better system nowadays. I still a lot to be improved, but anyway. Let's see. I retired January 2024, thinking about going back to work and keeping Social Security benefits. Does this affect my son, who is a child? Yes. Who is a child, adult, disabled on that SSDI. So let's see here. Okay, so your son is a disabled adult child. Yes, if benefits stop, they stop pretty much for everybody. Yes, so if you go over and your benefits are suspended because of work, then yes, everybody on that immediate record is also suspended. Not divorced spouses. So if you're a divorced spouse receiving benefits on an ex-spouse and that ex-spouse goes back to work or something like that, it doesn't affect you. So there's that. Darlene, is it true if you draw SSI, SSI is a welfare-based program, so and you marry someone else that draws SS disability, you will get less money if you get married? Yes, same type of situation. SSI is a welfare-based program, so if you marry someone that's making money, then SSI will look at that as household income. So you have to think of it as, okay, if I'm receiving SSI and I marry a millionaire, will my welfare be reduced? Yeah. Obviously, Social Security disability is not a millionaire, but there is money coming into the house. So it really depends on how much that disability benefit is. So, Jeffrey, what's up? I'm being told if I move to Alabama, I can keep my Plan G from New Jersey, but I'll have to pay an unknown fee. How much? Yeah. So you'll have to get re-rated. So you won't lose your Medicare supplement plan, but you'll just have to be re-rated possibly to that new state. But that's also an opportunity to change. That's a special enrollment period that you can possibly change your Medicare supplement plan and find a cheaper one, or switch to an N, or whatever the case may be. So when you make that move, give us a call, and my people can help you out. They're licensed and contracted in all 50 states. Let's see, Marcia, how do you receive retirement benefits and SSI benefits? Good question. So SSI benefits, again, welfare-based program, and this year the max you can get is $943. Okay, so you get SSI based on two factors: either being disabled or what Social Security calls as aged, 65 and older. So let's say you're receiving SSI aged, you're 66 years old, but you are insured for retirement benefits, and you're receiving $500 a month for retirement benefits because you didn't work very much in your life. You can't live on $500, so you apply for SSI, you're approved for SSI, you continue to get your $500 from retirement, and you get a second check on top of that for $443, for a total of $943. So that's how you do that. And then because you're paid into Social Security, you get Medicare. And then because you're receiving SSI, you're probably what they call categorically eligible for Medicaid. So you get SSI, retirement, Medicare, Medicaid, prescription drug help, Medicare Savings Program. SSI or Medicaid is paying for your Part B premium. Because you're dual eligible, you get a Medicare Advantage plan, and you get some extra benefits, and one of those grocery cards, and help with dental and all this kind of stuff. So that's all the moving parts that unfortunately people fill in parts of the puzzle, but they have big pieces of the puzzle missing, and they struggle even more. So that's why we are here. Linda, if I receive a divorced spouse benefit, but now they're deceased, can I apply for deceased spouse benefits and get more money? No, because it's automatic. You get that if you're on somebody's record, a divorced spouse, and that person passes away, everything is automatic. You're automatically switched to survivor benefits. You don't have to do anything. So I get people contact me all the time and says, I don't understand. My Social Security check was, $1,100, and now it's like $2,200. So what's going on? Am I going to have an overpayment and stuff? And I'm like, where's that 1,100 come from? Oh, some of mine plus some of a divorced spouse. And I'm like, oh, do you keep in contact with it? I haven't got a clue where that person is. Well, they've passed away. And that's why you've gotten double the amount, because again, spouse benefits up to 50%, surviving spouse benefits up to 100%. So you don't have to do anything except for use that extra money. Let's see. My husband will turn 65 years old in March 2025. He is covered on my medical insurance for my work, although where he works offer medical insurance as well. So what's the first to do? Yeah, if he stops working from his own place, then he signs up for Part A and Part B, but he doesn't have to because he also receives health insurance from yours. Not sure why he has double, but anyway, yeah, if you're currently working and your employer, the plan has 20 or more employees, and he's happy with it, not paying some crazy deductibles or something like that, then no, he does not have to sign up for Part B. If he wants to go ahead and start his Social Security monthly benefits, then he has to sign up for Part A, which I'm sure will be free for him, free in terms of the monthly premium. So that's a zero premium. So, and then sometimes that helps out, even if you got health insurance from work and if you go into the hospital, it might be like a $2,000 or $3,000 deductible. Medicare Part A deductible is $1,632. So you might actually save money having Part A and it's zero. So that's why, definitely get it. Unless you have a health savings account. If you have a health savings account, you have to stop contributing to that health savings account 6 months before. But no, but in terms of Part B, the one that costs the money, if he has health insurance from your work and you're currently working and 20 employees and yada, 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 good. Doesn't have to do anything. Just sign up for Part A, sign up for money. But so again, he can just sign up for Part A and don't sign up for Part B and don't sign up for money, or he can sign up for Part A and start his Social Security money coming in, but refuse Part B. So any one of those variables works. And then once you stop working, and therefore he stops receiving health insurance from your current work, then he has 8 months to sign up for Part B to avoid that penalty, because the penalty is 10 months for every 12 months you don't sign up for Part B when you're supposed to. So if you continue to work and he's 80 years old when you stop working, then he just has to fill out a couple of forms. One of those he takes to your employer, and your employer says, yeah, don't penalize him. He's had health insurance from her work since he was 65, and there's no penalty whatsoever. So easy, easy, easy. J-Lo, what assets do they look at if you apply for both Medicare and Medicaid to help with the $174 you're talking about? Yeah, pretty much all type of assets. Medicaid is it's a federal program in California. They call it like Medi-Cal, but because California has to do everything unusually. But anyway, but each state administers a little bit differently. Medicare is the federal that you pay FICA taxes. Medicaid is a state administered health insurance program, but it's also federal money as well. So there are some limitations of what states can and can't do, but it depends on your particular state. If you have 401ks or IRAs or money in the bank or stuff like that, they will look at all of that. If you have a life insurance, a burial insurance policy, usually they give you a kind of a break for a burial insurance policy if it's not a cash surrender value. And if you have like a second car, they will look at that. If you can have one car, you're fine. If you have a second car, that might be an issue. If you have a second home, that'll be an issue. So, and the rules and regulations change, it seems like, on a regular basis. So, super long story short, if you're having difficulty paying for that $174 or more, just as important, if you know someone, please, let's look out for those in our community. If you know someone having difficulty paying for that $174, tell them to file for Medicaid and get that Part B paid for. Unfortunately, once you do it, it takes time to get approved. And then it takes even longer to get everything set up, because Medicaid will pay for your 174. So they'll notify Medicare and Social Security. And so there are going to be 3 different computer systems talking to each other, 3 bureaucratic beasts talking to each other. So sometimes it takes a while, a month or 2 months for that 174, but they will give you that money back. Barbara, just turned 65 and have Medicare Part A and B. What else do I have to do? Something about a penalty if I don't do C or D. Yes, I always kind of focus on the B, but D as well. If you don't sign up for Part D the same time you sign up for Part B, you'll be penalized for the drug plan, 1% for every month you did not sign up for it. So Barbara, what you need to do is figure out how you're going to cover all the gaps, because Part A and Part B is awesome. You paid for it all those decades, but there's a lot of gaps. I think there shouldn't be. I think the whole system should be changed, but until then, it is what it is. Part B, there's a 20% co-insurance. So if you have a $100,000 bill, you pay $20,000. So that's why everybody gets either a Medicare Advantage plan or a Medicare Supplement plan. If you can fit it within your budget, I highly recommend a Medicare Supplement plan, a Plan N or a G. But if it's just not in your budget, I did a video on yesterday why you shouldn't get a Medicare Supplement. There's several reasons, budget reasons. You have other health insurance, whatever the case may be. But there's also Medicare Advantage plans. A lot of those are 0 premium now, but prior authorizations and networks and everything. So if you want help, give us a call there, call that number, email me, scan that little QR code and fill out the little form and say, hey, I want to review all the plans in my area and see what I should do. And that's a completely free. Nobody charges you for that. Yes, that's a fact. SSI is a needs-based program. Yes. All right. Other people answering questions. I like that. Got a community here. Martha, collecting divorced survivor benefits for 3 years. I'm 65 now. Do I qualify for any additional income from him only? No. Mine is just short by a fraction on credits. Also, are there grants for housing? Ooh, a lot of questions there. No, yeah, in terms of benefits from him, if you're receiving the survivor benefits, then that'll be it. Obviously, you'll get the COLA increases. If you're receiving retirement benefits, spouse benefits, surviving spouse benefits, disability, everybody gets those COLA increases automatically. And we won't know what the COLA increases are for about another 2 weeks. And then I'm going to do a series of videos on all of the changes for 2025 and the inside scoop and all those. And the next question is, do I qualify for any additional income from him? No, because you're already on survivor benefits. Mine is just short by a fraction on credit. So yeah, it sounds like even if you file for benefits on your own record, it won't be more than survivor benefits, but it doesn't sound like you're insured at all anyway. So grants for housing, HUD, yeah, we really got to do something in this country about affordable housing. So there are some proposals of politicians currently running for president, but we know what, political promises. But that's the trick. Whoever becomes president, then we look back and say, hey, you promised X, Y, and Z, and now it's time to put your money where your mouth is. So that's our job. I did a video on that, our Project 2025, and everybody thought I was talking about, that Heritage Foundation 2025. And I'm like, no, our Project 25 is to, make sure Social Security and Medicare are solvent and make sure, we're all protected in what we paid into Social Security and Medicare, and hopefully increase the benefits and, make sure it's there for our kids. And that's our Project 2025, the project that we need to do in 2025 when the new politicians take into office. I wasn't talking about the heritage. I just used the name. But anyway, Lori, I forgot to ask earlier, but I think you mentioned the processing of uncomplicated application will have about 90-day or so completion. I've taken hundreds of thousands of retirement claims, and you walk into the office, I ask you all the questions, and by the time you stand up and start walking to the door, your case is adjudicated. So it's done. So, but nowadays, Social Security is at a 27-year low staffing. So, it depends on, if you did an online application, where it goes to local office. So there's processing centers, ICTUs, and everything's kind of changed because the staffing is still so low. And that is a conscious effort by those wanting to privatize Social Security to make Social Security customer service terrible. So you will complain and just throw your hands up and say, forget about it, give it to Wall Street. And then Wall Street says, yeah, it's ringing their hand. Yes, our project worked. I've never heard of SSI. What are the requirements? Yeah, it's a means tested. SSI celebrates its 50th anniversary this year. It was started in 1974. And so you're like, no, it wasn't started in 1935. No, that's Social Security. SSA was started in 1935. SSI, Supplemental Security Income, was started in 1950. So it's a means tested, again, SSI disability, SSI aged over 65, and low income, low resources. All right. Can you start Social Security retirement payments and delay receiving Part B? 100%. If you have health insurance from current work, yours or your spouse's, please do not waste money on Part B if you don't need it. Yes, please. Let's see. My dad passed 2013, and with him went his CalPERS pension. Yeah. That's a whole different, the state, California, non-covered. Lee, anyone 55 and older is subject to a state recovery if getting Medicaid. How does this affect Advantage plans? It doesn't really affect Advantage plans necessarily. If you run out of money and you're in a nursing home, end of care type of facility, end of life type facility, and you run out of money, and the state Medicaid office starts going in there and paying for that for you, and you pass, they can, it depends on your state. Texas, the person always calls me up and says, "There's Lady Bird in Texas." Yes. So there are some exceptions, but in most states, they can come after your home. So you're like, "Oh, I'm going to give my home to my kids." Well, yeah. What you have to do is put that in an irrevocable trust 5 years before you pass away, because most states have a 5-year look back, where if you do it like a year or so before that you pass away, then they can still grab your house and sell it and take that money and reimburse the Medicaid. So, all right. Taking Tug, what's up? My ex-husband died years ago, and surviving child benefits meant our minor son's college fund was gradually restored, replacing dollars my ex had withdrawn and spent in violation of our divorce decree. Yes, there's a proposal out there to increase child benefits. It used to be in the old days to what, 22 or college or something. But now it's 18 years old or until they graduate high school. There's a proposal out there to increase it. But yeah, hopefully. Diana, I saw one of your videos this morning. She is calling about divorce benefits. She thought he had to die to get benefits. Sad thing, she could be have been collecting for 10 years. Yes, that's the tough part of all of this is, yeah, the YouTube comments and people coming into the live Q&A and said, I wish I would have known that 5 years ago or 10 years ago. My life would have been so much easier. Um, yeah, we've found someone that got $30,000 back pay because they walked into a Social Security office. Social Security office didn't do the right thing, and they had a protective filing going back a few years. Hey, when that person walked into the Social Security office 3 years ago, they should have done this, but they dropped the ball. So we were able to get that person that $30,000 back pay. And yeah, so that's why we're here. And as I always say, I can't do this alone. I'm just sitting some idiot here talking into a camera every single day, and it doesn't get anywhere unless y'all press like and subscribe and share and all that kind of good stuff and teach this stupid, YouTube algorithm that people need to see this. So there's that. Why did Social Security tell me my full retirement age was September 2023 for survivor benefits, and I turned 67 January 24? Also, okay, number one on that is survivor benefits full retirement age is different. Yeah, it's weird, strange. That's because for retirement spouse benefits, divorce spouse benefits, you can start your benefits at 62. So your full retirement age is, what they established back in the 1980s, 66 and 8 months, 67. But survivor benefits, you can start at 60. So your full retirement age for survivor benefits is a few months different. So that's why, yeah, it's strange. It's confusing, but that's what it is. Also, Social Security said there is no delayed retirement credits for me because my husband died at 39 years old and in service. That is correct. So your survivor benefits, you can get delayed retirement credits if your deceased spouse delayed retirement. So if they passed away at 39, then they obviously didn't start their benefits at 69 or 70. So yeah, there's no delayed retirement credits for that. If a spouse passes away at, let's say, 69 years old, and they hadn't been receiving Social Security benefits, then Social Security assumes they were delaying their retirement benefits, but they won't do it till 70. They'll do it the month that person passes. So they'll give you the delayed retirement credits up until the month they pass 69, even if you're, but they were going to wait till 70. Yeah, sorry. Yeah. So Michelle, can I switch to ex-spouse benefits after SSDI converts to Social Security, or am I stuck? No, you can do it now. Yeah, because SSDI converts to regular Social Security at your full retirement age. So you can get divorced spouse benefits at 62. So if you're already 62, you might be losing some money here. So as people harass me all the time, I have to say at least once, call Social Security immediately, if not sooner. If you're 62 and older, call and get those spouse benefits. And again, if your benefit amount is less than their full benefit amount, then you can get your SSDI, continue to get your Medicare, and get divorce spouse benefits on top of it. Even if they haven't filed for benefits themselves, that doesn't matter. As long as they're 62, you can get benefits on their record. So, all right, let's see. Another, so since getting older is now a crime and I am mandated to enroll in Medicare, do I get fined if not? Yeah, it's a crime, but yeah, I mean, it's just, all insurance is the same. It's, if you only get your car insurance the month you have an accident, then yeah, all those companies will go bankrupt. So that's why they mandate you to sign up for Medicare at 65, unless you have health insurance from other places. So you have to get Medicare at 65 because you need to pay the premiums. So all the other people that are actually using those, just like car insurance, life insurance, and all the rest of it, you don't start your life insurance the month you pass away and then say, okay, hey, give me $1 million because I just signed up. No. So yeah, all life insurance or all insurance is the same. It's a pooled risk. All right, let's see. Going through another social media thing here. And is it safe for me to be employed either Southern California? Yeah, I'm not sure. Yeah. Yeah, again, if you're receiving retirement benefits, survivor benefits, spouse benefits, disability benefits, you are able to work and collect Social Security, any type of Social Security benefits, but there are limitations. Watch my videos on those limitations. All right, let's see here. I reach FRA and still working. Can I get my Social Security Okay, I already answered that one. Um, my dad passed in 2013, and with that went his CalPERS. Okay, the rest of the question. Since then, my 88-year-old mother has exhausted their savings, and she gets only $244 a month SSI. How can she get more from SSI? Okay, yeah. So so CalPERS is a California. That person worked for the state or city or county or whatever in California and did not pay into Social Security. It sounds like because there's about 5% of the American working population that pays into these separate systems that don't play with Social Security. They don't pay into Social Security. So your father was one of those, and therefore there are no survivor benefits for your mother from Social Security because your father didn't pay into Social Security. It sounds like if he worked at CalPERS and also did another job where he did pay at Social Security somewhere or another, then definitely check that out. Hopefully you have already checked that out to double check if there are any benefits or not from Social Security. And then the other one is if your mother now, the reason she's only get $244 from SSI is because SSI is counting other income coming into the house. If that other income has stopped coming into the house, then I would contact Social Security immediately, if not sooner, and say, hey, yeah, she was getting X, Y, and Z, but that stopped next month or the last month or 2 months ago, and they will recalculate. They'll do a reconsideration, redetermination of your SSI benefit, and hopefully increase her to the full 943. And in California, there's also a state supplement that California pays because it's just a tad bit expensive to live in California. 943 just doesn't do it. The state of California gives you an extra supplement on top of SSI. There's a couple $100 or more. Changes every year. So definitely do those. Thank you for looking out after your mother. Sure, she appreciates it. DD, if disabled and now 65, will I receive my deceased ex-husband full Social Security when I reach her full retirement age? I'm receiving survivor benefits now, but it's reduced. No, in that particular case, you're already receiving the reduced amount. So the video I did today about unreducing is, yeah, because you can't pay it back. You're after the 12 months and you can't do the survivor benefits like that. And anyway, and the work that you do doesn't, get you a adjustment of the reduction factor or anything. In terms of the survivor, you'll just get the COLA increase. So yeah, it doesn't increase to the full benefit amount. Sorry. Carol, my husband filed early. I'm 64. For survivor benefits, do I receive 82%, 82.5% of the full PIA or the amount he was receiving at the time of death? Can I get his full check at 64 instead of my full PIA at 67? Okay, survivor benefits are a nightmare to figure out because there are so many different moving parts. So if your spouse was not receiving benefits or filed at their full retirement age or beyond, then and if you're your full retirement age, then you'll receive 100%, but that's not you. Um, your spouse filed early. So there is what's called a widow's limb, a rib limb, a widow's cap, that you can either get 71.5% or 82.5% of that first person's full benefit amount. And it really depends on a lot of variables. So what I would do in this case, because there's so many moving parts, is call up Social Security and schedule an appointment, because just don't ask the person that answers the phone what the benefit amount is, because the people that answer the phones or that work at the front windows are what's called customer service representatives, and they're not the Title II claim specialists, the Title II of the Social Security Act, the retirement survivor disability experts. So you need to schedule an appointment and get your day, they'll call you at your house if you do a phone appointment, and you ask them, says, okay, I want to file for survivor benefits on this person, and I want to start my benefits this month. And they'll run all the calculations and they'll come up with whether it's a Windex or a rib limb or whatever the calculations, depending on those moving parts. And they'll tell you, okay, if you start your benefits this month, here's how much you're going to get. And you'll say, okay, well, what if I start it next year? And then it's super easy. They'll go into MCS and change the MOE. Done it a few 100,000 times. They'll change it from September 2024 to September 2025, and they'll punch out a different number, and they'll say, okay, if you start it next year, it'll be X amount. And then you can sit there and think about it for a bit or sleep on it, call them back in a week. But if you say, oh, okay, I want to go ahead and start my benefits this month, yeah, go ahead and pull the trigger and start my money now. Or if you're, oh, no, it'll be a lot more if I wait till next year, then you say, oh, okay, all right, well, never mind. I'll call you all back next year. And they'll say, okay, bye. And they'll go on with their other 400 cases they have to work. So that it's, yeah, you're not going to, you're just like, oh, I've so inconvenienced you. No, no, they like it when you say, okay, all right, talk to you next year. Okay, bye. So they haven't lost a sale like a car salesman or something like that. They're very happy that you just walked out, because they have 400 other cases to work on. So that's my recommendation on that. The other stuff, retirement benefits, survivor benefits, disability, all those calculations are easy, but survivor benefits are, yeah, it's just, and there's companies out there that, say they can give you some type of manual calculation on it, and retirement benefit money calculation. I've seen thousands of those people. How much you pay for that? Oh, I paid $400 for this report. And I'm like, well, it's wrong. So don't waste your money on those. Just, yeah. All right. Hilda, what's up, Hilda? I'm 67 years old on Social Security and was married for 14 years and was going through divorce, but did not sign the papers, and he passed away 2 months ago. Can I apply for survivor benefits? Yes, absolutely, 100%, because you were married 14 years, or you're still married as of 2 months ago. Doesn't matter. You fulfilled both. And survivor benefits, you had to, actually wasn't 10 years because you weren't divorced, because you're technically not divorced. You only had to be married to them for 9 months. So yeah, no, you're 100% good. You can definitely call up Social Security, and because you're 67, you're at your full retirement age, you'll receive 100% of that person's benefit amount, not necessarily their primary insurance amount. It depends on when they filed again. Same type of strange thing with survivor benefits. You receive 100% of that person's benefits, but their benefit in terms of their PIA or their MBA. The PIA is the primary insurance amount, of when, if they had waited till their full retirement age, or their MBA is their monthly benefit amount. If they filed early or they filed at 70, you get the delayed retirement credits as a surviving spouse. So that's why I say the whole thing is complicated on that one. So, but yes, Hilda, third time today, call Social Security. immediately, if not sooner, and set up an appointment for survivor benefits. So you'll need the marriage certificate, and technically, I guess you didn't get divorced. So unless that person got remarried to someone, but then that's called a putative marriage. And so Social Security, but you've got the 10-year marriage anyway, regardless, or the 9-month marriage. So you're good. So either way, you're fine. So go get that money and come back here and tell us how Social Security treated you. June, I just recently found your channel and would like to know how to go from disability to just widow's benefits. Well, you don't switch, you add that other one on top of it. So you continue to get your disability, and you also get survivor, widow's benefits, widower benefits, all the same thing above and beyond that. So if you're at least 60 years old, call Social Security immediately, if not sooner, and file for survivor benefits. And please share that news. There's so many people out there that are struggling just on receiving disability benefits, but they're scared to get survivor benefits or spouse benefits because they think that's going to stop their disability. And they're like, okay, well, survivor benefits is more. That's fine. I like that. If my disability stops, that's not a big deal because survivor benefits is more, but I will lose my Medicare. Incorrect. If you get survivor benefits, spouse benefits, independently entitled divorce spouse benefits, whatever, that'll go on top of your disability minus your own amount. Again, the calculations, but you'll get disability, and because you have disability, your Medicare will continue, and you'll get that other benefit. And then when you hit your full retirement age, your disability will switch to regular retirement benefits. So you'll receive retirement benefits, Medicare, and survivor benefits, spouse benefits, and all that kind of good stuff. So you're receiving 3 different things there. Do they look at savings and 401k? Not sure. Was this part of a previous question? Yeah, if you were talking about SSI, yes. Supplemental security income, yes. They look at all that. If you're talking about annual earnings limit for retirement, spouse benefits, and all that kind of stuff, no. That's not earned income. Sweet Stella, what's up, Sweet Stella? Called Social Security and was denied for my survivor benefits from my deceased husband. I am still working for the state. Turned 60 last April with early income from 67,000. I'm confused with the earnings limit. Yes, you weren't denied. You were just, they can pay you, and you're like, if you demand, yes, I want that check, and then they will process your claim, but they won't pay anything because you're making 67,000 a year, so you're making way over the annual earnings limit. Again, this is if you're under your full retirement age. So you're basically what, $50,000 over. So they're going to hold back $25,000 of benefits. So they can, I guess if you demand that they start your benefits, they okay, we'll start your benefits, but you're not getting anything this year because you're making over the annual earnings limit. Even if you're working for the state and you don't pay into Social Security yourself, that income still counts against you. So, but once you stop working and once you stop working to reduce your work and start receiving survivor benefits, but once you start receiving that non-covered pension, you'll be subject to the government pension offset. So there's that. Kim, hey Kim, what's up? Asking for aunt. There we go. I have to come up with little graphics where the confetti comes down and anybody asks for somebody else. I'm trying to figure out this YouTube thing, but anyway, if spouse gets deceased spouse pension, if she remarried, will she lose it? If spouse gets deceased spouse pension, if she remarries after 60, no. So pretty much anybody that receives Social Security, spouse benefits, divorce spouse benefits, if they get remarried, they lose those benefits. But if you're receiving survivor and spouse benefits, you can get remarried after the age of 60 years. Yes. Yeah, Deb is, you might be able to get the lump sum of 255. Was your husband collecting Social Security at the time of the death? Yeah, that $255 lump sum death benefit, it's been the same for decades. You have to Surviving spouses can receive that, but you had to be the actual surviving spouse, not a divorced or spouse. But yeah, the $255. They do this. They do the application. Social Security does the application at the exact same time. Survivor benefits and the lump sum death payment. Yeah, if you were actually the surviving spouse and still married, because it's supposed to go for the burial insurance, which obviously, yeah, doesn't cover the burial at all. Robert, I'm going to go back and work and get enough hours to qualify for active health insurance. I am paying for Part B now. Can I cancel Part B and activate it again when I lose my active health? Yes, just call them up and suspend your Part B. Yeah, if you're going to work a few years and have health insurance from work, then yeah, no use in paying for Part B. And then when you stop working, you just, fill out all the forms. Dee, why am I paying such a high copay now if I'm disabled? My Medicare and supplemental benefits haven't changed. Yeah. If you're getting supplemental benefits, Medicare, um, then yeah, that shouldn't change, because if you have N or a G, N or a G is the same this year, next year, 5 years from now. But if you have a Medicare Advantage plan, yes, they do change. There's people say all the time, I've had a Medicare Advantage plan. I've had the same one for 4 years. No, you haven't. You might have had the same card and the same company and all that kind of stuff, but everything under the hood of that plan has changed every single year. And again, this month you'll get the annual notice of change. It'll tell you all the changes for next year. So if you want help reviewing that, click on that button, call us, email me and say, hey, Ed, when the new plans come out in October, put me on your schedule and we'll find a time to review it with you. So if your copays have changed, then that means you're in a Medicare Advantage plan, and they change every single year. So you get a new plan every year. But the health insurance companies hope you just say, let it ride, and say, well, I don't want to take the hour out of my life to review my plan and save myself hundreds or thousands of dollars. So I like it, and it's still zero copay, and it's still got the same doctor I like, and it has my prescription. So I guess I'm good. And then the health insurance company is like, yes, thank you. Because what they do is they don't get to be billion-dollar health insurance companies for nothing. They change all the stuff. $100 this month for in case you go to a hospital per day. Or this year, next year it's $500. MRI $100. Next year it's $300. And and then you come back here and say, oh, I didn't know my plan changed that much. There you go. Stephen, I'm 64, turned 65 next June. I'm disabled. I have Social Security Part A and Part B along with retirement health insurance with my old employer. Do I need to sign up for a supplemental plan now? Yes, because you're not exempt. I have Social Security Part A and Part B along with, okay, so you already have Part B, so you're not going to penalize there. Okay. So if you're new to Part B, so that's the times you can get a Medicare supplement plan without any health underwriting is when you're 65 or you're new to Part B, in the sense of, you've been working up until 70, you stop working at 70 and you just sign up for Part B for the first time. Then Medicare supplement plans can't deny you. Medicare Advantage plans never deny you. So you can sign up for those anytime. I would definitely check out all your options. But if you have a retirement health insurance and you're happy with it, then you don't really possibly. If you know for sure that retirement health insurance plan is going to continue forever and ever and ever, a lot of those are actually switching to Medicare Advantage plans because the board of directors of the company is like, oh, we can save so much money on retirement plans by, Anyway, if you're happy with it, then continue it. But if not, maybe there might be something out there that is better than your current plan. All right. Wow. We're way over an hour. Let me get one or two more questions of people I don't recognize here. Rashina, I'd never seen here before. Hello. Welcome. Need help to pay for Part A. Not enough work credits. Cannot sign up for Medicare supplement plans or Medicare Advantage without Part A and Part B. I receive SSI. Yes. So if you, you didn't pay into Social Security enough and you weren't married to anybody, any spouse benefits or surviving benefits, you can get Medicare based on their record. But if not, then I would reach out to Medicaid and find out if Medicaid will pay for it, because the state Medicaid, that's why they pay for Part B and all that kind of stuff, because the accountants, bean counters, did their math, and they say, okay, we can pay for this person's health care $10,000 a month, or we can pay for this person's Part A and Part B for $500, $600, $700 a month, and the federal government will handle everything else. So that's why they like paying for that to move costs over to the federal government. So it's all a crazy bureaucracy. So call up Medicaid and yeah, see if they'll pay for your Part A and or Part B. All right, let's do one last here of somebody I don't recognize. Okay, here we go. And this will be the last one. And if I didn't answer your question, I apologize. We're running out of time. I will be back again tomorrow. Cut and paste your question when I start tomorrow. Post that and I'll be able to get to yours first. Sorry, but I've run out of time here. I'm retired, living abroad 18 years, haven't been back in over 10 years, and I don't see going back and having paid into Medicare. But if something happened, what will be the penalties I have to pay? Yeah, I get that a lot. People, expats, go overseas and they say, well, I'm never coming back. And then they eventually come back for whatever reason, sick or homesick or political situation in their new country. Yeah, if you were supposed to sign up at 65 and you didn't for the last 10 years, you come back, then you're going to get 100% penalty, 10 years, 10% for every 12 months you did not sign up for Part B. So this year is $174.70. You're going to pay that times 2. So you're going to get that penalty. And you can't sign up until the general enrollment period, January, February, March. If you sign up in January, your Part B will start in February 1st. That's a recent law change that happened a few months ago. So there that is. All right. Thank